Andy. I wanted to talk today about what you want to expect if you're planning to deliver in a hospital during this COVID pandemic. There are some slight differences that you will want to expect if you're planning a delivery during this time. Most hospitals right now are having very strict rules on visitors and visitation rights because of the pandemic and limiting as much as possible the number of people coming in and out of hospitals. What that means is that if you're planning a delivery, what will most likely happen is just you and your partner will be allowed to come into the hospital for the duration of your stay. And once you come in, no one will be allowed out of the hospital. So where typically when we're not in pandemic times, your partner or spouse may be able to go out and get you some food, come back in. Right now, they're not allowing things like that to happen. Of course, there's other ways around this. Food deliveries are still happening, so you can usually make other things work, but you're both kind of hunkered down in there, which may change any other arrangements you need to plan for while you're planning your delivery. So if you have pets, you may need more extended care for them, or if you have other children at home, you may also need to arrange for other care for them while you guys are in the hospital. Most hospitals are recommending that people wear masks during delivery. There's obviously a fair amount of huffing and puffing that most women do when going through a natural birth, and if you are having a C-section, you would be wearing a mask anyway. So be prepared to be wearing a mask. You can bring your reusable mask that you have at home if there's certain ones that you particularly like, and they may also prefer that you wear disposable surgical masks that they have in the hospital. So that would be important for both you and any partner or spouse that's with you in the hospital at the time. The other important thing to keep in mind is if anybody does come down with COVID or test positive for COVID, there may be different restrictions on your ability to be with your baby immediately following birth. Every hospital is following different protocols with this, so depending on what your hospital has, it will be a good thing to double check with them prior to going in so you kind of know what to expect if for some reason you test positive. The good news is that most hospitals are very supportive at helping you to pump if you plan to breastfeed. If you can't be with your child, you can always pump and make sure that they're getting your breast milk right away and making sure that your breast milk supply is coming in. And hopefully as soon as it's safe for both you and baby, they'll be able to get you guys together. If you have any other questions about delivery or anything related to COVID, feel free to reach out to us at any point in time. We're happy to answer any questions that you might have.